All right, so now we're moving on to the ankle. And what I would do for the ankle, most of my ankle special tests, I would have Izzy in this position. I like to have the ankle kind of dangling down, and I would have a stool and sitting in front of her. And that just, for me, I feel like it loosens up that posterior chain, so I don't have to fight with the Achilles or the gastroc being tight or anything. So this is my go-to position. But for visual reasons, we're going to have her on the table and we'll talk about it that way. So what I'm going to have her do is she's going to spin around, she's going to put her feet this direction first. And the first one we're going to do is the anterior drawer, and this is your bread and butter of an ankle eval because the most commonly sprained ligament, right, is that ATF there. So it stops the talus from sliding forward. So we're just going to make that happen. Like I said, I like her bent or with the bent leg, but we'll do it here. So what you're going to do here is you're going to grab the calcaneus, and you're also going to grab and stabilize at the tibia, and then I'm going to pull that forward at the calcaneus. Now, I don't know if you can see this, but I'm really just stabilizing with the tibia side. It's only the calcaneus side that I'm moving and trying to slide forward. The mistakes that happen with this test is we want movement to happen, so we do this. And what I find is that she has dorsiflexion, right? And that's not what I'm looking for. I want that hand still, and I'm just looking for that little bit of movement forward, right? So you'll see sometimes in that sinus tarsi, you'll see that movement if they've had a tear in the past too. The next thing we're going to do is the talar tilt. Again, I would have her off the side, but for these purposes, we're going to come here. I'm going to get her in that position. I'm going to kind of grab that talus right below the malleoli on each side, and I'm going to tilt into eversion and to inversion, right? So what I'm going to target there is going to be the middle portion of that deltoid ligament and that calcaneofibular ligament when I come into inversion, right? So opposed to, we were targeting that ATF on the first one. The next one we're going to do is Kleigers. So Kleigers is to test for that high ankle sprain or that syndesmotic ankle sprain. So what we're going to do here is we're going to push her into full dorsiflexion. I'm going to stabilize at the tibia, and I'm going to kind of externally rotate when I push her into that. The idea there is to push that fibula away from the tibia. It shouldn't move a lot. If it does, right, then that's where we may have a little bit of irritation, and she's going to have pain in the area for the syndesmosis. So that's our easy test for that one. The next one we're going to do for the ankle is called the Thompson test. So for that one, I'm going to have Izzy flip around. So for the Thompson test, what we're going to do is, this is for the Achilles, and all we're going to do is squeeze at the calf, and you can see her foot move there when we squeeze. If there's not an Achilles, then it's not going to move like that. But you will also probably see visually when you're doing the rest of your eval that the signs that are going to tell you that there's a ruptured Achilles. So this is just a test to see. Now, if it's a partial tear, then what you may see is that calcaneus move one direction or the other where the tear is, like away from the tear.